What is a CT scan? A computed tomography scan allows doctors to see inside your body. It uses a combination of X-rays and a computer to create pictures of your organs, bones, and other tissues. It shows more detail than a regular X-ray. You can get a CT scan on any part of your body. The procedure doesn't take very long, and it's painless. How do CT scans work? They use a narrow X-ray beam that circles around one part of your body. This provides a series of images from many different angles. A computer uses this information to create a cross-sectional picture. Like one piece in a loaf of bread, this two-dimensional, 2D, scan shows a slice of the inside of your body. This process is repeated to produce a number of slices. The computer stacks these scans one on top of the other, to create a detailed image of your organs, bones, or blood vessels. For example, a surgeon may use this type of scan to look at all sides of a tumor to prepare for an operation. How are CT scans done? You'd probably get a scan at a hospital or radiology clinic. Your doctor might tell you not to eat or drink for a few hours before the procedure. You may also need to wear a hospital gown and remove any metal objects, such as jewelry. A radiology technologist will perform the CT scan. During the test, you'll lie on a table inside a large, donut-shaped CT machine. As the table slowly moves through the scanner, the X-rays rotate around your body. It's normal to hear a whirring or buzzing noise. Movement can blur the image, so you'll be asked to stay very still. You may need to hold your breath at times. How long the scan takes will depend on what parts of your body are being scanned. It can take anywhere from a few minutes to a half hour. What is it used for? Doctors order CT scans for a long list of reasons. CT scans can detect bone and joint problems, like complex bone fractures and tumors. If you have a condition like cancer, heart disease, emphysema, or liver masses, CT scans can spot it or help doctors see any changes. They show internal injuries and bleeding, such as those caused by a car accident. They can help locate a tumor, blood clot, excess fluid, or infection. Doctors use them to guide treatment plans and procedures, such as biopsies, surgeries, and radiation therapy. Doctors can compare CT scans to find out if certain treatments are working. For example, scans of a tumor over time can show whether it's responding to chemotherapy or radiation. Are there any risks? CT scans use X-rays, which produce ionizing radiation. Research shows that this kind of radiation may damage your DNA and lead to cancer. But the risk is still very small. Your chances of developing a fatal cancer because of a CT scan are about 1 in 2,000. But radiation's effect adds up over your lifetime. So your risk increases with every CT scan you get. Talk to your doctor about the procedure's potential dangers and benefits. Ionizing radiation may be more harmful in children. That's because they're still growing. They also have more years to get exposed to radiation. If a child needs CT scan, you may want to ask the doctor or technician if the CT machine settings have been adjusted for a child. Tell your physician if you're pregnant. What are the side effects? Sometimes it is done with contrast materials. Few people may have allergy to it. Most of the time, the reaction is mild. It can lead to itchiness or a rash. In very few cases, the dye may trigger a life-threatening reaction. For this reason, your healthcare provider may want to monitor you for a short period. Tell your doctor about any allergies you have to medications, seafood, or iodine. Although it's rare, contrast materials can lead to kidney problems. Let your doctor know if you have any kidney issues before the CT scan. Like, share, and subscribe. wellness4free.com